A nursing student is instructed to remove a client's ear packing and instill eardrops. What action by the student requires intervention by the registered nurse? A. Assessing the eardrum with an otoscope. B. Inserting a cotton ball in the ear after the drops. C. Warming the eardrops in water for 5 minutes. D. Washing the hands and removing the packing. Answer: D. Washing the hands and removing the packing. Rationale: the student should wash his or her hands, don gloves, and then remove the packing. The other actions are correct. A client is going on a cruise but has had motion sickness in the past. What suggestion does the nurse make to this client? A. Avoid alcohol on the cruise ship. B. Change positions slowly on the ship. C. Change your travel place. Answer: D. Try scopolamine, ter answerderm scop. Answer: D. Try scopolamine, ter answerderm scop. Rationale: scopolamine can successfully treat the vertigo and dizziness associated with motion sickness. Avoiding alcohol and changing positions slowly are not effective. Telling the client to change travel place. Answer is not a caring suggestion. A nurse is teaching a community group about preventing hearing loss. What instruction is best? A. Always wear a bicycle helmet. B. Avoid swimming in ponds or lakes. C. Don't go to fireworks displays. D. Use a soft cotton swab to clean ears. Answer: A. Always wear a bicycle helmet. Rationale: avoiding head trauma is a practical way to help prevent hearing loss. Swimming can lead to hearing loss if the client has repeated infections. Fireworks displays are loud, but usually brief and only occasional. Nothing smaller than the client's fingertip should be placed in the ear canal. A nurse is irrigating a client's ear when the client becomes nauseated. What action by the nurse is most appropriate for client comfort? A. Have the client tilt the head back. B. Reposition the client on the other side. C. Slow the rate of the irrigation. D. Stop the irrigation immediately. Answer: D. Stop the irrigation immediately. Rationale: during ear irrigation, if the client becomes nauseated, stop the procedure. The other options are not helpful. A nurse is teaching a community group about noise-induced hearing loss. Which client who does not use ear protection should the nurse refer to an audiologist as the priority? A. Client with an hour car commute on the freeway each day. B. Client who rides a motorcycle to work 20 minutes each way. C. Client who sat in the back row at a rock concert recently. D. Client who is a tree trimmer and uses a chainsaw 6 to 7 hours a day. Answer: D. Client who is a tree trimmer and uses a chainsaw 6 to 7 hours a day. Rationale: a chainsaw becomes dangerous to hearing after 2 hours of exposure without hearing protection. This client needs to be referred as the priority. Normal car traffic is safe for more than 8 hours. Motorcycle noise is safe for about 8 hours. The safe exposure time for a front row rock concert seat is 3 minutes, but this client was in the back, and so had less exposure. In addition, a one-time exposure is less damaging than chronic exposure. The client's chart indicates a sensorineural hearing loss. What assessment question does the nurse ask to determine the possible cause? A. Do you feel like something is in your ear? B. Do you have frequent ear infections? C. Have you been exposed to loud noises? D. Have you been told your ear bones don't move? Answer: C. Have you been exposed to loud noises? Rationale: sensorineural hearing loss can occur from damage to the cochlea, the eighth cranial nerve, or the brain. Exposure to loud music is one etiology. The other questions relate to conductive hearing loss. A client is scheduled for a stapedectomy in 2 weeks. What teaching instructions are most appropriate? Select all that apply. A. Avoid alcohol use before surgery. B. Blow the nose gently if needed. C. Clean the telephone often. D. Sneeze with the mouth open. E. Wash the external ear daily. Answer. B. Blow the nose gently if needed. C. Clean the telephone often. D. Sneeze with the mouth open. E. Wash the external ear daily. Rationale. It is imperative that the client having a stapedectomy is free from ear infection. Teaching includes ways to prevent such infections, such as blowing the nose gently, cleaning objects that come into contact with the ear, sneezing with the mouth open, and washing the external ear daily. Avoiding alcohol will not help prevent ear infections. A hospitalized client has Meniere's disease. What menu selections demonstrate good knowledge of the recommended diet for this disorder? Select all that apply. A. Chinese stir-fry with vegetables. B. Broiled chicken breast. C. Chocolate espresso cookies. D. Deli turkey sandwich and chips. E. Green herbal tea with meals. Answer. B. Broiled chicken breast. E. Green herbal tea with meals. Rationale. The diet recommendations for Meniere's disease include low sodium, caffeine-free foods and fluids distributed evenly throughout the day. Plenty of water is also needed. The broiled chicken breast and herbal tea are the best selections. The stir-fry is high in sodium and possibly monosodium glutamate, MSG, also not recommended. The cookies have caffeine, and the sandwich and chips are high in sodium. A client had a myringotomy. The nurse provides which discharge teaching? A. Buy dry shampoo to use for a week. B. Drink liquids through a straw. C. Flying is not allowed for 1 month. D. Hot water showers will help the pain. Answer. A. Buy dry shampoo to use for a week. Rationale. The client cannot shower or get the head wet for 1 week after surgery, so using dry shampoo is a good suggestion. The other instructions are incorrect. Straws are not allowed for 2 to 3 weeks, flying is not allowed for 2 to 3 weeks, and the client should not shower. A client has severe tinnitus that cannot be treated adequately. What action by the nurse is best? A. Advise the client to take anti-anxiety medication. B. Educate the client on nerve-cutting procedures. C. Refer the client to online or local support groups. D. Teach the client side effects of furosemide, Lasix. Answer. C. Refer the client to online or local support groups. Rationale. If the client's tinnitus cannot be treated, he or she will have to learn to cope with it. Referring the client to tinnitus support groups can be helpful. The other options are not warranted. A client is scheduled to have a tumor of the middle ear removed. What teaching topic is most important for the nurse to cover? A. Expecting hearing loss in the affected ear. B. Managing postoperative pain. C. Maintaining NPO status prior to surgery. D. Understanding which medications are allowed the day of surgery. Answer. A. Expecting hearing loss in the affected ear. Rationale. Removal of an inner ear tumor will likely destroy hearing in the affected ear. The other teaching topics are appropriate for any surgical client. The client is admitted to the nursing unit after having a tympanoplasty. What activities does the nurse delegate to the unlicensed assistive personnel, UAP? Select all that apply. A. Administer prescribed antibiotics. B. Keep the head of the client's bed flat. C. Remind the client to lie on the operative side. D. Remove the iodoform gauze in 8 hours. E. Take and record postoperative vital signs. Answer. B. Keep the head of the client's bed flat. E. Take and record postoperative vital signs. Rationale. The UAP can keep the head of the client's bed flat and record vital signs. The nurse administers medications. The client should lie flat with the head turned so the operative side is up. The nurse or surgeon removes the gauze packing. The student nurse is performing a Weber tuning fork test. What technique is most appropriate? A. Holding the vibrating tuning fork 10 to 12 inches from the client's ear. B. Placing the vibrating fork in the middle of the client's head. C. Starting by placing the vibrating fork on the mastoid process. D. Tapping the vibrating tuning fork against the bridge of the nose. Answer. B. Placing the vibrating fork in the middle of the client's head. Rationale. The Weber tuning fork test includes placing the vibrating tuning fork in the middle of the client's head and asking in which ear the client hears the vibrations louder. The other techniques are incorrect. A client has Meniere's disease with frequent attacks. About what drugs does the nurse plan to teach the client? Select all that apply. A. Broad-spectrum antibiotics. B. Chlorpromazine hydrochloride, thorazine. C. Diphenhydramine, Benadryl. D. Meclizine, Antivert. E. Nonsteroidal anti-inflammatory drugs, NSAIDs. Answer. B. Chlorpromazine hydrochloride, thorazine. C. Diphenhydramine, Benadryl. D. Meclizine, Antivert. Rationale. Drugs such as chlorpromazine, diphenhydramine, and meclizine can all be used to treat Meniere's disease. Antibiotics and NSAIDs are not used. A nurse is teaching a client about ear hygiene and health. What client statement indicates a need for further teaching? A. A soft cotton swab is all right to clean my ears with. B. I make sure my ears are dry after I go swimming. C. I use good earplugs when I practice with the band. D. Keeping my diabetes under control helps my ears. Answer. A. A soft cotton swab is all right to clean my ears with. Rationale. Clients should be taught not to put anything larger than their fingertip into their ears. Using a cotton swab, although soft, can cause damage to the ears and cerumen buildup. The other statements are accurate. An older adult in the family practice clinic reports a decrease in hearing over a week. What action by the nurse is most appropriate? A. Assess for cerumen buildup. B. Facilitate audiological testing. C. Perform tuning fork tests. D. Review the medication list. Answer. A. Assess for cerumen buildup. Rationale. All options are possible actions for the client with hearing loss. The first action the nurse should take is to look for cerumen buildup, which can decrease hearing in the older adult. If this is normal, medications should be assessed for ototoxicity. Further auditory testing may be needed for this client. A client is scheduled for a tympanoplasty. What actions by the nurse are most appropriate? Select all that apply. A. Administer preoperative antibiotics. B. Assess for allergies to local anesthetics. C. Ensure that informed consent is on the chart. D. Give ordered anti-vertigo medications. E. Teach that hearing improves immediately. Answer. A. Administer preoperative antibiotics. C. Ensure that informed consent is on the chart. Rationale. Preoperatively, the nurse administers antibiotics and ensures that informed consent is on the chart. Local anesthetics can be used, but general anesthesia is used more often. Antivertigo medications are not used. Hearing will be decreased immediately after the operation until the ear packing is removed. A client hospitalized for a wound infection has a blood urea nitrogen of 45 mg per deciliter and creatinine of 4.2 mg per deciliter. What action by the nurse is best? A. Assess the ordered antibiotics for ototoxicity. B. Explain how kidney damage causes hearing loss. C. Use ibuprofen, Motrin, for pain control. D. Teach that hearing loss is temporary. Answer. A. Assess the ordered antibiotics for ototoxicity. Rationale. Some medications are known to be ototoxic. Diminished kidney function slows the excretion of drugs from the body, worsening the ototoxic effects. The nurse should assess the antibiotics the client is receiving for ototoxicity. The other options are not warranted. A client with Meniere's disease is in the hospital when the client has an attack of this disorder. What action by the nurse takes priority? A. Assess vital signs every 15 minutes. B. Dim or turn off lights in the client's room. C. Place the client in bed with the upper sitarails up. D. Provide a cool, wet cloth for the client's face. Answer. C. Place the client in bed with the upper sitarails up. Rationale. Clients with Meniere's disease can have vertigo so severe that they can fall. The nurse should assist the client into bed and put the sitarails up to keep the client from falling out of bed due to the intense whirling feeling. The other actions are not warranted for clients with Meniere's disease. A client has external otitis. On what comfort measure does the nurse instruct the client? A. Applying ice 4 times a day. B. Instilling vinegar and water drops. C. Use of a heating pad to the ear. D. Using a home humidifier. Answer. C. Use of a heating pad to the ear. Rationale. A heating pad on low or a warm moist pack can provide comfort to the client with otitis externa. The other options are not warranted. A nursing student studying the auditory system learns about the structures of the inner ear. What structures does this include? Select all that apply. A. Cochlea. B. Epitympanum. C. Organ of Corti. D. Semicircular canals. E. Vestibule. Answer. A. Cochlea. C. Organ of Corti. D. Semicircular canals. E. Vestibule. Rationale. The cochlea, organ of Corti, semicircular canals, and vestibule are all part of the inner ear. The epitympanum is in the middle ear. A client has labyrinthitis and is prescribed antibiotics. What instruction by the nurse is most important for this client? A. Immediately report headache or stiff neck. B. Keep all follow-up appointments. C. Take the antibiotics with a full glass of water. D. Take the antibiotic on an empty stomach. Answer. A. Immediately report headache or stiff neck. Rationale. Meningitis is a complication of labyrinthitis. The client should be taught to take all antibiotics as prescribed and to report manifestations of meningitis such as fever, headache, or stiff neck. Keeping follow-up appointments is important for all clients. Without knowing what antibiotic was prescribed, the nurse cannot instruct the client on how to take it. A client has a hearing aid. What care instructions does the nurse provide the unlicensed assistive personnel, UAP, in the care of this client? Select all that apply. A. Be careful not to drop the hearing aid when handling. B. Soak the hearing aid in hot water for 20 minutes. C. Turn the hearing aid off when the client goes to bed. D. Use a toothpick to clean debris from the device. E. Wash the device with soap and a small amount of warm water. Answer. A. Be careful not to drop the hearing aid when handling. C. Turn the hearing aid off when the client goes to bed. D. Use a toothpick to clean debris from the device. E. Wash the device with soap and a small amount of warm water. Rationale. All these actions except soaking the hearing aid are proper instructions for the nurse to give to the UAP. While some water is used to clean the hearing aid, excessive wetting should be avoided. The nurse works with clients who have hearing problems. Which action by a client best indicates goals for an important diagnosis have been met? A. Babysitting the grandchildren several times a week. B. Having an adaptive hearing device for the television. C. Being active in community events and volunteer work. D. Responding agreeably to suggestions for adaptive devices. Answer. C. Being active in community events and volunteer work. Rationale. Clients with hearing problems can become frustrated and withdrawn. The client who is actively engaged in the community shows the best evidence of psychosocial adjustment to hearing loss. Babysitting the grandchildren is a positive sign but does not indicate involvement outside the home. Having an adaptive device is not the same as using it and watching TV without evidence of other activities can also indicate social isolation. Responding agreeably does not indicate the client will actually follow through.